Hey, 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 come on in the room. It is 7:02 and it's Dr. Kre. Welcome, welcome, welcome. Tonight we're going to talk about 5 signs that you may need to be checked for colon cancer. So welcome to Dr. Kre and me, and we will get started in just a minute. Welcome, 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 welcome. It is Monday, October 23rd, and we're going to be talking about 5 signs that you should be checked for colon cancer. When you get here, let me know that you're here. Welcome, 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 welcome. It was a beautiful day here in Birmingham. A little bit chilly. We have to wear our jackets now, but it is still worth it. There was no rain. Hey, Tanya. So tonight we're going to talk about 5 signs that you need to be checked for colon cancer. So when you get here, come on in the room and let me know that you're here and who you are. We're going to talk about, which is very important because there are so many young people getting diagnosed with colon cancer here lately, that we really need to talk about what are some of the signs and symptoms. Hey, Angelica. Hey, KJ. How is Auntie Baby doing today? I hope you had a great day, and thank you for joining. We're going to talk about 5 signs that you may need to be screened for colon cancer. So, KJ, you're just rooting us on because this is kind of for you. You're a lot of years away from having to be screened from colon cancer. So we're going to get started in about 2 minutes. We'll get started at 7:05. It's like 7:04 now, so we'll get started in 1 minute. Have y'all had a good day? Angelica, was y'all day good? Welcome, welcome, welcome. So in 1 minute, we're going to get started, and we're going to talk about colon cancer. I have known several young people less than 50 years old to get diagnosed with colon cancer here recently. So I felt like it would be very important for us to talk about, do you need to be screened or not? Oh, that's good. You had a great day. So, let's see. It's just about, hey, Dave and Denise, welcome. We're going to talk about 5 signs that you may need to be screened for colon cancer, or 5 reasons why, because they're all not signs. I'm going to get started. You know who I am. I'm Dr. Kre. I'm a board certified family medicine physician, and I specialize in what's important to you through my tips, my educational moments, my practice, my telehealth, my concierge medicine, my coaching, my mastermind. I help you become a better you. Yes, I know you're already fabulous, right? But if I can add 1 more day to your life, then I'm happy about it. And I know that makes you happy as well. So that's why I'm here to help to add more good years, valuable years to your life. So today we're going to talk about 5 reasons why you may need to be screened for colon cancer. Number 1, the first one is very simple. You're 50 years old. So, the recommendation everywhere is that if you're 50 years old, then you need to have a colon screening. So somebody write that in the chat. Number 1, that you're 50 years old. So at 50 years old, this can be done by several ways. The infamous one is a colonoscopy, where you have to take at least 2 days off of work. You start drinking PrEP about a day or so before the procedure. You drink all of this Miralax, which helps you to run off Gatorade, Gas-X. You have all of the fixings. You can't eat anything solid. You drink all of that. It cleans your bowel out. And you then go the next morning, usually pretty early in the morning, get what's called a colonoscopy. They give you some medicine in your veins. They put you to sleep a little bit. You're not so asleep that you can't like flip over and turn around. If they say, hey, turn on your side, you can follow directions with them, but you have no recollection of any of that's going on. So you drink all of that stuff. You're up all night using the bathroom. You're cleaned out. And then the next day, they make you sleepy, and then they put some lube on this flexible light, and then they put the scope up your bottom, look around all the way until they get all the way over here to the They start at the bottom, all the way over here to the far side on the right side. They try and go to where your appendix is, if you still have an appendix, close to that area. So if they can get all the way over there and you're cleaned out right, the worst thing you can do is go try and prep for colonoscopy. And they're like, ma'am, you're going to have to do it again because you had too much poop in there. You had poor prep. You never want that. So drink the stuff. You have to do it once every 5 years. So what are they actually looking for? They are looking for cancer, for tumors. They're looking for polyps. So polyps, somebody write polyps. A polyp, it can be a precancerous lesion. That's P-O-L-Y-P, polyp. Polyp can be a precancerous lesion. So if they see polyps there, they usually take a little grass, snatch the polyp out, and then send it for further testing. They do a biopsy on it. The pathologist looks at it and says, hey, you know what? This is not cancerous. Hey, Shantae, thank you for that. This is non-cancerous. This is non-cancerous, or it is actually precancerous. Thanks, Tim. Thanks, Angela. So if you have a precancerous area, then they'll say, hey, we need to either check your, depending on how precancerous, they decide how drastic the precancer is, and they'll say either repeat your colonoscopy in 1 year, in 3 years, or in 5 years. But if they go through there and they look, there are no polyps, there are no masses, there's nothing in there, they say, hey, we'll see you back in 10 years. Because usually colon cancer is very slow growing. Usually. Up until lately, we've seen people that get colon cancer, they'll take part of their colon out, have some chemo, have some radiation, and live long lives up until the last 5-6 years. So I'm thinking that it may be something that we're ingesting environmentally, or we're exposed to environmentally, because it's starting to be seen younger and younger and younger. So the first thing is, if you're 50 years old, you will be sent for screening. So the most invasive one is a colonoscopy. Or you can do another one that's called fecal occult blood test. So somebody put that in there, FOBT. So colonoscopy, type colonoscopy, and somebody type FOBT. So that's when you go in to the doctor, and the doctor puts some lube on their hand, and they go in and get some into your bottom, and then they get some stool, and they put it on a card, and they put a little drop of ointment on there, and it reads, hey, this is yes, blood is in your stool or not in your stool. Thanks. Hey, Awana. So the FOBT looks for blood. So a lot of times you may have blood in your stool and you don't even know it. So when you use the bathroom, make sure to look back there to see, hey, do I have blood that I can see? So the blood may be bright red. If it is bright red, then think maybe hemorrhoids, maybe you strained too hard, you got a little tear. Or if it's dark red, it's old blood. And it may be coming from your stomach, if you esophagus, if you got an ulcer, you can pass your blood. That blood is old. It's kind of gone through your gut and finally come out your bottom. So colonoscopy is invasive. FOBT is where we just do that test and say, yes, you have blood in your stool, or no, you don't have blood in your stool. So yes, you do have blood in your stool. We refer you on to the colonoscopy. If you do not have blood in your stool, when we do the FOBT, we just recheck it in a year. So that, and then now I'm sure you guys are seeing the commercials for Cologuard, C-O-L-O, guard. Somebody type that in the chat, Cologuard. It is a more invasive test that they send you this kit at home and tells you how to poop on the stick, put the stick in appropriate containers. You call your UPS guy, they come get it. A lot of insurances do pay for it if you have Medicare. So Viva Medicare pays for it well. Cigna Health Springs Medicare, that pays for it. United Healthcare Medicare pays for it. But Blue Cross doesn't necessarily pay for it. We're having a lot of trouble with Blue Cross paying for it. So, but with that test, be mindful that it is not as specific for colon cancer as a colonoscopy. If you want to know without a shadow of a doubt, do you have colon cancer or not, you need a colonoscopy. So we have these other means out there that we can do, FOBT, the Cologuard. You can do those things. However, we won't be for sure unless you have your colonoscopy. So back to that. Number one, you're 50 years old. Number two, you may need to be checked for colon cancer if you have a first-degree relative that has had the diagnosis of colon cancer. So what does first-degree relative is? That's number two. Somebody type that in. First-degree relative with diagnosis of colon cancer. So first-degree is your mom, your dad, your sister, your brother, your grandmother, your grandparents, So parents, siblings, grandparents. And then, so if they got diagnosed with it when they were 75 years old, you still get your screening at 50. But if they got diagnosed with it when they were 45 years old, then you need your first colonoscopy when you were 35 years old. So we'll need it 10 years before that person got their diagnosis. Does that make sense? So if your mom got colon cancer at 55 years old, whether she lived or not, that's been irrelevant. So if she got it at 55, hey Auntie Deborah, if she got it at 55, then you need your colonoscopy at 45. Hey Teresa. So you need your colonoscopy 10 years before your first degree relative, parents, parents, grandparents, and siblings. That's first degree. However, if they got diagnosed after they was 50 years old, don't worry about it. You still gonna get your diagnosis you still gonna get your colonoscopy at 50. So this is what concerns me, because there are so many young people getting it now. I'm really hoping that they actually will drop that age down and say, hey, we can get colonoscopies at 40. That you can get a colonoscopy before 50 years old, but if you don't have any symptoms, insurance will not pay for it. Okay, Sean said, my dad died at 37 from lung cancer. How often do I need to be checked? So lung cancer is a different one, because that is usually, was your dad a smoker? That's usually contributed by some kind of environmental factor. And the only way usually we screen for lung cancer is if you get an x-ray. So if you've gotten chest x-rays for pneumonias and stuff like that, then we know that, hey, there's no cancer there. However, if you are a smoker and you can get what's called a CT scan, a low radiation. There's not as much radiation as the normal CT scans. They'll do a low rad CT scan on you if you have a history of smoking, and then that can check you for colon cancer. That can check you for lung cancer. I'm sorry, Sean. So he was a smoker. If you're not a smoker, then chances are that it's not hereditary. But if you are a smoker, you may need one of those low dose CT scans, or you may just need to make sure you get periodic chest x-rays, because lung cancer is one of those things that'll show up on a chest x-ray as something kind of fuzzy or something different, and they'll say, hey, we see something abnormal on this chest x-ray, so now let's do a CT scan. Okay, so we said number one, if you're 50 years old, then yes, you need to be screened for colon cancer. Number two, if you have a first degree relative, that was diagnosed early in life. When I say early, that's 50 years old or less. Hey, Keisha, 50 years old or less, or 55 and less. Anything that will make you have to do your colonoscopy before you're 50 years old. Like my grandmother was diagnosed with colon cancer, but she had colon cancer later in life. So my parents didn't have, my dad and his sisters didn't have to have colonoscopies until they turned 50 years old. So it wasn't like they had to go and do anything out of the ordinary, and then I won't have my colon until I'm 50. Well, that's not true. I'm gonna have my colon before then, because it's too much going on around. So Yes, so I recommend if you're having any symptoms, which we're going to talk about some symptoms in a bit, to tell your doctor so your doctor can schedule you a colonoscopy, because that's the only way a lot of times that you will know that anything is lurking. So number one, you're 50 years old. Number two, you have a first-degree family history of colon cancer. Number three, if you have unexpected weight loss. Yeah, you're not like you eating like a pig and you enjoying yourself and you like, but I'm still eating and I'm just losing all of this weight. Then we need to start doing some labs. That's not just to be screened for colon cancer. I start looking for any kind of cancer. So someone write in the chat, number three, unexpected weight loss. Drastic weight loss. So when I see unexpected weight loss, I'm like, oh my goodness. We need to check for leukemia and lymphoma. That's a blood draw. We need to check for lung cancer. That's a chest x-ray. We need to check for prostate cancer. That's the rectal exam and the prostate lab, the blood draw. And colon cancer is colonoscopy. And also if you have unexpected weight loss, I'll check for HIV as well. So those are the things that's on my list. But unexpected weight loss, and you're like, I'm just not really hungry. I don't really have an appetite. I'm kind of nauseated all the time. Yeah, let's start thinking about cancers. Even if you're young, let's start thinking about that. Even breast cancer can have unexpected weight loss. So number one, we're 50 years old. You need to screen anyway. Number two, you have a family history of first degree relative with colon cancer. Number three, unexpected weight loss. Number four, this is the big one. If you have blood in your stool, we talked about blood in the stool earlier and what colors it can be. However, but if you got blood in your stool, that is not normal. That is not normal. Not normal. So if you're constipated, you know, hey, okay, I got hemorrhoids, I'm a little constipated. Now I see blood in my stool. Even then, I still would not take that for granted. I'm like, yeah, you got blood in your stool. It's bright red. I see hemorrhoids back there when I do my exam. Or not, I'm still sending you to the GI doctor, which is the gastroenterologist. He's the doctor that does the colonoscopies. You're still going to go get that colonoscopy because we want to make sure that we're not missing anything. We want to make sure that we're not just being nonchalant and taking for granted that bad things do happen. And the quicker that you know, the quicker that you realize I got this symptom, let's get it looked at, the faster you can get treatment. So, 50 years old, you need a colonoscopy. Number two, first degree family member. If they've had it and they were diagnosed at 50 years or younger, you're definitely going to need one early. Number three, unexplained weight loss. Number four, blood in your stool. That's bright blood. That's, dark blood. If you're white and you see a little bit of blood on your tissue, you can probably wash that. But if you look in the toilet and there's blood everywhere, the water is now pink, the water is red, that's a problem, y'all. Get help. Get to the doctor so you can get your colonoscopy, because you may have a bunch of polyps in there. Who knows? The only way you're going to know what's going on is with the colonoscopy. So you come, you say, I got blood in my stool. We'll do the fecal test. That test confirms, yes, you have blood in your stool. We'll check your labs, make sure you're not anemic, because you could be having a slow bleed. I've had plenty of people have what's called a GI bleed, where they're bleeding up top from an ulcer in their stomach, from what you can have what's called diverticular bleed. If you've had a colonoscopy in your life and your colonoscopy says you had these little pockets in your colon, those are called diverticuli. They don't bother you until they bother you. So they're usually just sitting there. Years and years ago, they would say you can't have, you should not have nuts, you should not have corn, you should not have all these lists of things. However, nowadays they say you can eat whatever you want, but just know that they're there. They can get inflamed. They can bother you. They can cause you to have stomach pain, and it's usually down here in the left lower part of your belly, where you're like, oh, I got pain there, I got some cramping there. You can have fevers with that, but you have a whole different set of symptoms than just the blood in your stool. If the blood is all in the water, 911 needs to be called. Exactly. Get somewhere or call your doctor first thing the next day if it's after hours. So, 1, you're 50 years old, you need a colonoscopy. 2, first-degree family history, which is parents, siblings, grandparents. You need to be screened for colon cancer. 3, unexpected weight loss. Even though that's a general and broad topic, cancer is still on my list. Yes, it could be your thyroid. Yes, it could be, now I got a bad appetite and I got something going on with your belly. However, we still need to think of, if I don't think of it, I can't diagnose it. So I still got my long list of things. I may not freak you out and say, well, I'm thinking that she may have cancer, but it's still on my list. So I'm going to do the blood work, check your x-rays, send you for a colonoscopy. So those things are important. So when your doctor calls and say, hey, yes, ma'am, the insurance company say it's time for you to have your colonoscopy. And you need to have your colonoscopy. Don't tell them you're not going to go do it because you don't want to have it anymore. Go get it done. If you don't care about living, your family does. You have kids, you have grandkids, you have nieces and nephews. They need to know what runs in your family. If you have had a colonoscopy, you have polyps, please tell your family. They need to know so they can be monitored and checked on a routine basis, or even more frequently than what insurance will cover. So insurance will cover you one screening starting at 50 years old. But if you're younger and you have these symptoms, insurance will cover that. So don't worry about whether insurance pays for it or not. If you got blood in your stool, you losing all this weight, you definitely need to get a colonoscopy. We'll figure out how to pay for it later. Okay, so the next one is number 5. Number 5. And the last one is if you have changes in your bowels. So number 5, somebody type changes in your bowels. That means if you have, usually look at your stool when you have a bowel movement. That's your body. It comes out of your body. What you put in makes its way on out of there. So don't be afraid to look. Look. So if you got a turd, for the lack of a better word, if you got something back there and it's looking like this, and then all of a sudden in the middle it narrows down like this, and it's big on this side, skinny on them in the middle, and big on the other side, then you could have a mass. So what could be happening is you got formed stool. Then you got this big mass, and as it tries to squeeze by the mass, it's narrowing. You get that stool is narrowing, and then it expands. So you're like, pencil, if it looks like a pencil lead skinny, that's a problem. It is, because your colon is thick. It's open like this. So you should be able to get poop through there. If you're eating enough fiber and if you're drinking enough water, we shouldn't be having no skinny little poop. Your stool should not be skinny. So that if you have changes in the way your bowels look, then that can be problematic. So number 1, you have to be, if you're 50 years old, they're going to pay for your screening, whether you're having symptoms or not. Number 2, first degree family history of colon cancer. Number 3, unexpected weight loss. Number 4, blood in your stool. Number 5, changes in your bowel patterns. So be mindful that you're watching your body, because we had a very near and dear to us friend who was diagnosed with colon cancer last May. And she was very in tune to her body. She had gone and got labs like the 6 months before. Her labs were totally normal. Then all of a sudden she started having some nausea, some vomiting, some unexplained weight loss. She couldn't stand the way the food smelled. So she thought, oh my gosh, I'm pregnant. So she went in, had a pregnancy test, and sure enough, she had a positive pregnancy test. Well, the tumor that she had was a cruel tumor, because the tumor was secreting the same hormone as the pregnancy hormone. So she ended up having a positive pregnancy test. Well, just so happened when people get pregnant, you get an ultrasound. She had a great ultrasound tech in that the ultrasound, hey Destiny, the ultrasound tech looked there and saw that there was no sign of a baby in the uterus, And as far along as we thought that she was, there should have been something, a sac or anything. Well, the ultrasound tech just so happened, moved the wand up and looked in her belly and said, there's something up there by your liver. So she's like, oh, what? Something's up there by your liver. You need to go get a CT scan. So she went and got a CT scan done about 2 days later. Still had the positive pregnancy test. The level really was still about 10. So to be pregnant, you have to have a level of 5. So the level was still up just a little bit. So enough for her to make her still feel bad, make her still feel pregnant. But when she went for her CT scan, she actually had a huge mass right here on the right side, right up under her liver. So that day, she went for her colonoscopy. I mean, not colonoscopy. She went for her CT scan. They diagnosed her with colon cancer right there in the radiology suite. So they looked and was like, hey, you got a mass here, and the cancer has already gone to your liver. We see 2 spots on your liver already. So in the radiology suite, they diagnosed her. She was 35 years old with colon cancer. She had no family history. She had no blood in her stool. She had nothing but she was nauseated, unexpected weight loss, no change in her stool habits, none of that. So luckily, she had the positive pregnancy test. So of course, you're going to be going to the doctor soon about that. So went there, and she actually had a genetic mutated colon cancer. Like, no, her mom never had colon cancer, dad, nobody. She just had this fluke of a colon cancer. So she had her colonoscopy like a week later. And then probably like 3 or 4 days later, she had a colonoscopy. And then about a week later, they went in and removed the mass. But they could not remove the mass on the liver because it was taking up 2 sides of her liver. So you got 2 different lobes. You got several lobes of your liver. It was actually spread out over 2 lobes of the liver. So she was not able to, they were not able to remove that. So like, before she can get healed up with that good, she started to have chemo and radiation and all of this. And just so happened, she had an amazing oncologist that thought, let me check your blood work to see if you have some kind of mutation, because none of this makes any sense. So she was never, ever pregnant. The colon cancer was just secreting a pregnancy hormone. So after about 9 months of very, 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 very aggressive therapy, she passed away in January. So that's why this is so near and dear to me, because I feel like we take so much for granted. And we took that for granted. I mean, she was fine. She had labs in November. Her labs in November were totally fine. So you just like, you can't be like, you have to pay attention to your body. And luckily, she paid attention to her body, 1. And 2, I dreamt that something was wrong with her. So I got up in the night and called her. I was like, girl, I don't know what's wrong with you. Get up and go to the doctor. Because I saw you in the hospital bed. So luckily, between a combination of me worrying the mess out of her and her having a positive pregnancy test, we found out that she had stage 4 colon cancer, and she was 35 years old. And she died in January. So this is very near and dear to me. So please know your body, know your symptoms. Don't just say my labs were normal some months ago, so it must not be X. It must not be Y, because it really could. Yes, this was my friend. Yes, she was a doctor, and she was a soror, and she was one of my very best friends. And she, it just took her out so very, very, very fast. So, in memory of Tanya, I want you guys to know that you have to watch your body. She did. She watched everybody else's body. She was one of the baddest ER doctors that I absolutely know. So, because she took care of everybody else, I'm like, and she called and she said, well, I promise you, Kre, that I have not been not listening to my body. I did not pay attention to myself. I promise you that, because of course she thought I was going to fuss. I'm like, girl, I wouldn't fuss at you about this, because I'm always fussing. But I love you too, Awana. So in January, we went through that, and we're just taking it one day at a time. So I actually am going to get my colonoscopy before the year's out, because I just pay whatever it is that I got to pay to get it done, because then I can sleep a little bit better at night. So just know that colon cancer is real. It's attacking younger and younger and younger people. It has no socioeconomical boundaries. It is, I mean, she was at the top of her game. She was in her prime. And now she's one of our awesome angels. So I hope that you take care. Oh, yeah, I want you getting yours done too. Yeah, I'm pretty sure our whole crew is. So make sure that you talk to your parents, know your family history. I know a lot, especially in the Black community. They're not telling us what our grandparents had, our moms had, whatever. Ask them. Even ask when they went through menopause, so you can know when you would go through menopause, because that kind of runs in families, the age wise. So know your history. Know that I really want you to know, because it's still treatable. Hers was it was random that she had this mutation, but overall, people usually are diagnosed early. They can get treated, but here lately, I've heard so many cases of young people less than 50 years old getting the disease. So make sure when your doctor calls and say, "Girl, you need your colonoscopy," you just say, "Yeah, I'll take it. I'm gonna drink all that stuff. I'm gonna poop all night, but I'm at least know my colon is clean." So are there any questions? Let me see. I saw Tim Avery says, "Please do one on Alzheimer's because that runs in my family." Okay, I'll do one next week on Alzheimer's. My aunt said I got my colonoscopy after my mother was diagnosed with colon cancer. She's doing fine and my results are great. And yes, my dad has had several and his has been fine too. So I'm happy that you got yours. Let's see. I'm glad you enjoyed the show, Sean. I can attest to this in a different way. You really have to listen to your body and push your doctors if you don't feel everything is being done based on how you feel. Request full panel blood work. Yes, and don't be afraid to ask for a second opinion. I'm never offended if somebody's like, "Well, I hear you, but I want to get another opinion." Right. I'm going to check this labs and we're going to refer you over to the specialist, because it's my job to do the discovery and it's their job to do the treatment and from there. So I'm kind of, as a primary care doctor, I'm the gatekeeper. You bring it to me. It's up to me to gather the information and then disseminate the information based on where it needs to go. So good job, Keisha. Good for being on your doctors. Because a lot of times, if you're young, doctors are like, "Yeah, no, that's nothing. You're hypochondriac." No. Young people get sick too. Very informative. Glad you enjoyed it. I agree. Take care of your body. Your body speaks to you. Listen and follow through. She said, "This was great. Are there any studies linking environmental things to the early age of colon cancer diagnosis?" I don't think that it's been looked at long enough. But things that I would say that probably contribute to it is a lot of the plastics that we're warming all our food up in plastic. We're eating all this fast food and we really don't know what we're eating. We are eating all of these processed foods. We have a lot of high fructose corn syrup in our diet. And then we're doing a lot of the Truvias, the Splendors. And I'm like, Tanya had a great healthy. She was very into health. She always was exercising. So then my wonder was, well, she did Truvia. She did Splendor. She did the low calorie things, the diet Cokes. Well, was that something that added to it? That's always my question. So there's several studies out there, but I don't think that it's been looked at long enough to really tell us for sure if there are and what those are. So yes, thank you guys. I'm happy you guys enjoyed it. Take care of you. And if in doubt, if you need to try and figure out a way to get it paid, blood in your stool, go with that. Blood in your stool, they will get you a colonoscopy. All right, you know who I am. I'm Dr. Kre. I'm a board-certified family medicine physician, and I specialize in what's important to you through my tips, my teaching, my practice. I'll be doing some telehealth eventually, concierge medicine eventually as well. And I'm doing all of that so that you can live a healthier, happier life. When you know better, you can do better. And I expect that through all of this and me pouring out my heart, because I tell you all of my things, my issues, and those from people that are close to me, I hope that you learn to know that you have to love your body. You have to listen to your body. And I'm here to inform you about all of that. So thank you for joining me for Dr. Kre and Me, this show. And I will see you next week. We'll talk about Alzheimer's, Tim. So tag your family. We'll do that. And you can follow me on Twitter. I'm on Twitter at Dr. Kre. That's DOCTORKRE. That's DOCTORKRE on Twitter. And thanks for letting me pour my heart out to you. Love you. Have a good one.